Can I have your attention, please? Calling all new moms, seasoned moms, soon-to-be moms, and all you mamas in between.
Welcome to the Mom Friends Podcast. I am your host, Rach, and I am so happy to have you here. I hope this podcast gives you conversations that help you to not feel so alone. Because even though it seems like we're surrounded by bodies 24/7, motherhood can still feel really lonely at times. And how are we supposed to know all this stuff? Join us for conversations where we keep it real, keep it honest, and maybe even get a little controversial. There's only one little catch. This is a safe space and there is no room for judgment or mom shaming. So let's all be kind, keep an open mind, and enjoy ourselves. Let's get into it. Happy Mom Friends Monday! We are back with another solo episode, and I hope you're not mad about it because I have been busy, life has been crazy, I was sick, and there was a lot going on, and I haven't really had a chance to book anybody in yet. But more dual episodes to come. Today is just me, Mama Rach, and we are talking to all my boy mamas. But if you're a girl mama and you're here and you're curious, or you're not a mama and you're here and you're curious, well, welcome. I love you. We are talking about circumcision, okay? Do we give our sons the old snip snip? That's the big question when moms have boys. Because they're born and you're like, oh yeah, I have to think about that. Do I or don't I? I don't know what to do. I didn't know what to do. I didn't really think about it while I was pregnant. And then all of a sudden it was like, oh, I have to make this decision. But I didn't really have a strong opinion one way or the other. So I was like, what do I do? And I kind of leaned more towards my husband personally because I was like, I don't have a penis. So whatever you think, I'm cool with. And he was like, well, let's do it. And I was like, all right, we snipping. But if you don't know what to do, I'm going to try and give you some points that might tickle your fancy to sway you one way or the other. I'm not strongly opinionated, and from all the research I've done for this episode, which I will get into, the ultimate conclusion was there's not really anything strong in the evidence, health-wise or risk-wise or, religious-wise, that kind of thing that could strongly be this is what you need to do. So if you're on the fence and you're I just need something to cling on to help me make my decision, I got you. Let's start with just a little history lesson. If you don't know what circumcision is, I'm sure most of you do, but it's the surgical removal of the foreskin from the tip of the male's penis. So basically, they're born with extra skin covering their pee hole or urethral opening, and they just kind of snip it, retract it, and remove it, and then they don't have it anymore. And it was actually, fun fact for you, the first surgical procedure known to mankind that we know of. And it is thought that it was originally used as a form of punishment, less severe genital mutilation for prisoners of war. Wild. But then it was later adopted by Egyptian priesthood and other religions, and that tends to be now one of the biggest driving forces for people to have a strong push one way or another. Some religions think it's mandatory, and some religions are absolutely fucking not. And then others are I don't really care. So basically, Judaism is a big one, and I've heard this before, but I didn't really realize. So they believe it's a commandment that on the 8th day of the son's life, they get circumcised. And the only thing for them that would prevent that from happening is a big health issue, or they get really sick or something like that, and they would either postpone it or not do it. So yeah, a lot of Jewish people apparently. I think nowadays it's probably less because religion's getting a little bit more and more inclusive, I guess, and not as strict about certain things. But yeah, there are definitely still some Jewish practices that are yep, 8th day of your baby's life, snip, snip. Muslim is another one. Some websites were kind of hairy in this one, but they think a lot of them do believe it is mandatory to get circumcised. However, I guess it's not directly referenced in the Quran. I'm not entirely sure. That was kind of a wishy-washy one. But yeah, so a lot of Muslim culture believe in circumcision. But then on the other end, you have your Greeks and your Romans who are like, absolutely not. We do not believe in changing the human body. And they used to like long fucking time ago, they used to do sports in the nude, right? So they're like, actually, we need this skin to protect our little hole. And yeah, not let it get like dirt and shit in it. So, and if you look at like old statues in like Greece and like those kind of areas, then you can still see that on the males. So if you're a Greek or you're a Roman and you're like, yeah, okay, that makes sense. Or you're like, no, fuck that, I'm circumcised. I don't know. It's not foolproof. So if you do have like a religious background and you're like, oh, maybe I'll just like lean on that and like kind of do what like my family religion is, you can. Christianity at this point used to be against it, but now more in modern, they've kind of taken the stance that it's like, it's not really a spiritual thing. It's more of like a personal preference. So if you're Christian, sorry, that's not really going to push you one way or the other. They're like, we don't really care what you do. For those who are not religious and don't want to lean on that, generally I know that you will go to like more of like a health perspective. Like, is this better for my son's health in the long run, in the short run? And look at it that way. When I was in school as a nurse, I was always under the impression that like a non-circumcised male would get more UTIs or like a urinary tract infection than a circumcised, just because we're taught like under that skin, you know, there's more room for like bacteria to harbor and like grow if it's not cleaned properly. But anything I found, and like the doctor who did my son's said like it's not really strong enough evidence to like push that narrative. So that was kind of surprising to me. But there is a little bit of statistics there. So according to the Alberta Health Network, and I'll link all my sources for you lovelies, only 2 in 100 natural boys in the first 15 months of life develop a UTI. And then when they compared that with circumcised boys, it was 0 in 100. So if you need something, 2%, take it. Run with it. I don't know. It's not really a strong stat, but it's at least something. And then later on in life, it has shown that some studies show that men who are circumcised are less likely to get sexually transmitted diseases. But the evidence isn't strong. And most of the studies, especially one in particular from the Library of Medicine, say that in Africa, male circumcision decreases the acquisition of HIV in heterosexual men by 50%, but they didn't really put it against homosexual men. So I don't know exactly where the stance is on that one. I think it probably helps like a little bit, but again, not strong. Most sources say like evidence is borderline to inconclusive, so kind of take everything with a grain of salt. And it's pretty much completely up to preference. In Canada, the Canadian Pediatric Society doesn't like recommend the procedure as a routine procedure for all babies. So that's why it's kind of not covered. And a lot of times you have to pay for it. And it's not really covered by like health insurance and stuff like that. I don't know what it's like in the States. But I would assume not also. They don't recommend against it either though. So it's, again, one of those like optional things you can do. And for context, I believe like it wasn't cheap, but it wasn't aggressively priced. I believe it was just over $200 Canadian for us. That sounds right, but I could be wrong. I forgot to look that up because I forgot all about that. Anyways, another part of the conversation when deciding if you want to go through with this procedure, because it is a surgical procedure, could be risk. So I know some moms, no judgment whatsoever, really don't like to hear that like any risk is involved with anything with their babies, especially first-time moms, just because we're so like, oh my God, I want to protect this thing at all costs. I don't want to put them in a situation where something could happen. So let's talk about those. every single risk to this procedure is considered rare. It very rarely happens, hence the definition, hence the word rare I just used. But there's still always like a little bit of a chance. So I'm going to talk to you about it. The main one, which is still very rare, is infection. And that generally is something can be cleared up pretty quickly, and it doesn't happen very often. You just have to make sure, like, if you do get the procedure, that you're cleaning it afterwards and not ripping any scabs off and leaving like the wound open and stuff like that. And then the second most common but rare risk is bleeding. So generally babies, when they get the procedure, are only expected to bleed like a few drops during and then maybe a drop after, but like nothing else. And if they do happen to bleed a couple days after, like when you're at home changing the diaper, generally it can be solved with just putting some pressure, or you can use like a Jellifoam wrap, but it's not very severe. And like I think it was only like, it was like extra rare, according to the Stanford Medicine article, that the rare cases that require hospitalization and a blood transfusion only happened because there was an underlying bleeding disorder that the child had. So if something you do want to do, make sure you know your medical history, your family history, if you think there's a risk of that whatsoever. And talk to your doctor about all these risks, right? Like if you have more questions and you are concerned about them, but you are leaning towards getting it, then just have a conversation with your doctor and he'll walk you through, or she will walk you through all of that. There's a few other super rare complications, but obviously they have happened, so they need to be reported. And those are things like necrotizing fasciitis, which is like that like nasty skin eating stuff, gangrene, and meningitis. And there's like a few other like really minute ones that if you're really concerned, you can generally ask your doctor, like I said. Another reason moms choose not to circumcise is because they don't like any type of like medication whatsoever. I know there are definitely like a lot of moms out there that are uncomfortable with things like Tylenol. That's the only medication they use during the procedure. Technically not during, but before. And then sometimes like a lidocaine numbing topical cream. So it's just like almost like freezing a little bit around the tip before they do it. And then they just give them sugar water to distract them during the procedure. So I know for us, my son got a little bit of Tylenol about 30 minutes before they were going to do it. Just so, you know, it could like start working. And then they took him in and did the thing. And they said we could give it to him if he was like really uncomfortable afterwards for the first like 24 or 48 hours. But we didn't really feel like we needed to because he was like a champ. So we didn't even really, so he just had a little bit. But if you don't want him to have any at all, that might be something that would push you not to do it. And please, I'm not trying to, I feel like it would be really mean to do that without giving him some sort of analgesic. So just think about that. If you're like, I want to do it, but I don't want to give him Tylenol, I'm like, but like, they'll hurt. Poor little bean. That's just my opinion. The other avenue that sometimes can push people one way or the other is an argument made by like kind of like the polarizing side of things, but still an argument where they'll say like that is making a decision for your child without consent and causing genital mutilation. Not my words. Without the consent, and people believe it should be delayed until the boy's like at least 18 years of age where he can make that adult decision himself. Personally, I feel like that's a really aggressive way to look at it. I think when I think genital mutilation, I just think really more harsh, horrible, disgusting things. So I'm like, that's aggressive. But I can see the point of like doing something, changing someone's body without their consent, technically. So I see where that's coming from and I can respect it. I personally don't think that necessarily pertains to this conversation, because I think as parents, for the first at least 15 years of your kid's life, you're making decisions for them every single day. Because you're their parent, that's kind of your job. You're doing things in their best interest. And if you feel like getting your son circumcised is in their best interest long term, then do it. Like, you're their parent. You're not doing it to fuck them up or hurt them or, cause issues. No, you're doing it because you think it's the right thing. So there's an argument to that. And if you're resonating with that, then that's completely fine. It's not strong for me, but I'm going to share everything with you because I want you to be informed. And if you like I said, if you need something to cling on to, this is why I should do it, or this is why I shouldn't do it, that's what this episode's all about. And if you're sitting there and you're like, I think I want to do it, but I would love to know what happens. I know for me, when I'm kind of anxious about something, it really helps me to have somebody walk through it step by step so I kind of know what to expect, because that's where anxiety comes from, right? It's not knowing what's going to happen. I know I always talk to my mother-in-law because she kind of gets that way too. I remember she was going in for a scan at the hospital that I work at, and she's like, I'm really anxious and I just don't know where to go. And I was like, I totally understand this. So I literally drew her a map. I'm like, okay, you're going to walk in right away. You're going to see a mask station. This was when we had to wear masks. And then you're going to go straight a little bit. You're going to see this cafe. You're going to turn left. You're going to walk down the ramp. You're going to go through these doors. You're going to go. So she was like, oh my God. And I totally drew her a map. And she was like, thank you so much. It literally received relieved, slow down, relieved half of my anxiety. And I literally, when I started my job at that hospital, I had never been in there to the specific unit I'm working on. And I remember texting or talking to my manager, and she never even met me, but I was like, I am so anxious. Can you I don't know where to go. Can you explain it to me? And she did. And then I got one other person to explain it to me. So I knew at least where I was going. Cause I'm like, if I walk into work on my first day and I'm so anxious to start a new job, cause I just get so nervous about stuff like that. But if at least if I know where I'm going and I'm not just wandering around and going to be late, then I'll be kosher. So I totally understand that. So I'll explain our experience to you. One sec. Our experience was actually really smooth. We had an incredible doctor. He was lovely. Never met him before. He was only there's only certain ones in our area that do it. So we got recommended to this hospital, which is not the one I gave birth at. It was another one in a different town, by my sister-in-law and brother-in-law, because that's where they took their son. So they had a good experience. So we were like, okay. So yeah, our doctor was awesome, but still I was super anxious. So we kind of go in, we meet him. They take him up to the area, and we're sitting there. And I believe this was I think we had him on a Saturday. And I feel like we did the procedure on a Thursday, because they do say to do it within 7 to 10 days of their life. So it's pardon me, holy smokes. You don't have to. I think it's for less of risk of bleeding from what I've understood. Don't quote me on that one. But that was kind of my understanding. However, you can do it anytime. And if you're nervous to do it and you don't want to, your son can decide later on in his life if that's what he wants to do. He can still do it. So it's not if you say no, it's the be all end all. It's never going to happen. And if you're past the 10 days and you're still feeling do it, absolutely talk to your doctor. But yeah, so we got settled in a nice little waiting area, and the doctor came out and talked to us, walked us through the whole thing, basically start to finish, the different techniques he was going to use. Not that I could ever repeat that, because but we were able to ask the dumbest questions, and he was really funny, and he was so nice. So that was setting a good tone. The nurses were amazing. They came out, gave him his Tylenol, like I said, 30 minutes before, and I didn't think about the fact that they were going to take him away. And that was the first time he was going to be away from me in his whole life, because we were only 6 days in. So they come out and they're like, okay, we're going to take him now. And then I was pretty chill up until that point. I was like, oh, okay. All right. You're going to be fine. What am I doing? You're going to be fine. Oh my God. Oh my God. Oh my God. I was kind of I'm a new mom. Of course I'm freaking out. Like, I hope he's going to be okay, you know? So yeah, they take him to the other room, and it should have been a little bit further away because we definitely did hear like a little bit of crying at first. And it was like, I was crying too. I'm not going to lie. Like, I definitely shed some tears because it was an uncomfortable feeling. Like, your kid's away from you. You hear him crying in another room. That's so scary, right? I'm not trying to scare you. Trust me. I'll tell you why in just a second. And then it was like maybe 10 minutes, longest 10 minutes of my life, mind you, but maybe 10 minutes. And they bring him back. And he's calm, he's sleeping, he's a cute little bean. So I like fed him. And then I can't remember exactly. It started to spread out. So I think we had to be there for 2 hours afterwards. And they started like every 5 minutes, they'd come and like check the incision site. So they had to monitor for bleeding and make sure he was going to be okay before they sent us home. And then it like stretched to like 15 and then half an hour, whatever their checks were. And he was totally fine. He didn't drop a single blood. Didn't have a single drop of blood afterwards. And yeah, we just kind of hung out. He didn't fuss at all. And they told us that he did great during the procedure. The only time he cried, which is what we heard, was when they were changing his diaper. He did not cry during the procedure at all. And I believed her because my son, for the first at least month of his life, he was such a little monkey because he would hate anything like in his diaper. Like, the second he peed, he would like whine and fuss and cry. He hated his diaper being wet. Fuck, we went through so many goddamn diapers. Such a waste. And then if you went to change him, he'd cry about being changed. He hated having his diaper changed for the first month, but then he hated stuff in his diaper. So I was like, which one is it, bro? You have to pick one. All right. So yes, I totally believed her when she was like, that's the only time he cried was when we were changing his diaper. I'm like, that fucking makes sense because my child's psycho. But yeah, no, he did so good. And it did not seem to bother him after at all. And then your aftercare is for 7 days. They tell you to put a thick layer of like Vaseline or petroleum jelly. We had a thing that was non-petroleum jelly, but it's the same thing. It's basically just to keep the site from sticking to the diaper, so it can heal. Because if it's dry and there's a little bit of like dried blood and it sticks to the diaper and you have to pull it off, it's going to open a wound. And that's where you're going to increase your risk for infection and like extra bleeding and stuff like that. It never happened. It healed so well, and he was such a champ. So we had a really good experience. And I know our doctor said like it's very routine, and he never seen in his career doing it. I can't remember how long, like a few years at least, that he'd been doing it. He's never had anyone come back. He's never had complications, and he's never had any issues. So that was reassuring. And like we had talked about, all of the other health risks and stuff are so rare and so minute, and it's so rare for babies to even get a urinary tract infection in general. So I don't know. I don't regret doing it. I think I definitely like leaned on my husband. I think a lot of times, and it's kind of weird that I know this because I've had conversations with moms about their partners, but it's like men just like do what they know, right? And like for women that don't have a strong opinion, they kind of lean towards the partner who has a penis, right? So they do what they know. So if the dad's circumcised, they get the baby circumcised. If the dad's not circumcised, they don't. Generally speaking, from the conversations that I've had. So that could be something that pushes you one way or the other. But I think at the end of the day, there's not enough evidence. And I know that's like tough because I'm someone who's like, I just want somebody to tell me what to do. However, what I'm about to say, you might not want to hear. There is nothing in any of those points that we talked about that like pushes you on either side of the fence. So ultimately, it is up to you. It is a personal decision. Whatever your preference is, nobody can judge you for it. And also, that's like, it's your son's private parts. Yes, I'm talking about mine, but like, I'm here to help you. So I feel like I need to be open about my life. But it's your son's private parts. So if it's like you don't want to talk about it with anybody, you don't have to. And I'm sure your son would probably appreciate it. I know mine's still a baby, so hopefully like later on down he won't listen to this and he will not be like, oh my god, mom, we talked about. It's fine. But yeah, you don't have to talk about it if you don't want to. I'm doing it because I'm here to help you and I love you. Well, that's all I have for you today. I hope this conversation helped you in some way to at least feel comfortable about your decision. And if you have any other questions, if you feel like I missed something, hit me up, follow me on Instagram, TikTok, we can chat. I love you. I hope you have a wonderful Monday and enjoy the rest of your week. We'll talk soon. Mwah. Disclaimer. In no way do the conversations on this podcast replace the advice of health professionals. We are just speaking from our own experiences and what has worked for us. So speak to your midwives, OBs, or family doctors when necessary. When listening, always remember that every mom and every child is different, and what may work for one person might not work for another. There is no one way is the right way when it comes to parenting. Thank you so much for tuning in to this week's episode of Mom Friends. Please like and subscribe to us so we can grow our beautiful motherhood community together. Talk soon. Mwah.